OK， 大家好，非常感谢，大家参与了这一次，药治常人的公众放映以及，现在的讨论，我叫张怀宇，我是在加州的职业心理学家。Welcome everyone to the screening of medication normal and the post-screening discussion. My name is Huaiyu Zhang. I am a licensed psychologist in California. 我想声明一下的是，本次放映和讨论并非提供医学服务和建议。观影后的讨论部分，就这个部分是要录像，并且是在 ACHPPI 的频道上传的。A disclaimer is that this film screening and the post-screening discussion do not constitute any medical advice or suggestion, and the post-screening discussion part will be recorded and it will be uploaded to the ACHPPI channel in YouTube and Bilibili. 我想感谢一下过去1年以来志愿者师友们所参加的编辑的中文字幕然后感谢导演和制片人Lynn Cunningham 提供的片源以及Nicole Lamberson 提供的一些支持也感谢 ACHPPI 平台组织这次观影活动这次活动的目的是促进信息的交流以及促进独立批判性思维然后我非常抱歉的是大家没法在聊天框里面相互交流有具体的问题建议请输入到 Q&A 这个我们能看到但是你们彼此看不到这个信息然后如果在我翻译的过程中如果有什么疏漏或者错误也请输入到 Q&A 我会把它念出来I want to thank the volunteers that helped with editing the Chinese subtitles within the past year and thanks to the director and producer Lynn Cunningham for providing the film resource and thanks to Nicole Lamberson to help with preparing for this screening and thanks to the ACHPPI for providing this platform to play and do the discussion. And the purpose of this activity is to provide information, disseminate information, and to promote critical thinking. And 现在我想请2位嘉宾自我介绍一下我们先从安开始Ann, please start with a self-introduction.
My name is Ann Bracken. I'm an author who has published several poetry books and a recent memoir called Crash, a memoir of overmedication and recovery. And the reason that I'm here is because my story echoes the stories of just about everyone that you saw in the film. And in addition, I'm telling in the book, I'm also telling my mother's story, who was severely overmedicated for depression and chronic pain, as I was, but it was back in the 60s. And I was able to use my father's records to tell her story and weave it together with mine. And I suffered from severe depression for about 4 years in the 90s. And at the same time, I suffered from a chronic migraine for 7 years. And during all of that time, I was drugged with numerous psychiatric drugs as well as opioids. And the doctors always told me that this was the way to get well. Just take the drugs, go to therapy, and you're going to get well. Well, meanwhile, I got worse and worse to the point where I began to feel suicidal, much like the people in the film. And I chose to have electroconvulsive therapy. I'm not really sure what finally got me out of depression, but I credit a lot of it to my spirituality, my therapist, and poetry therapy. And another part of the reason I'm so interested in this topic is because I grew up in a home with a mother who suffered from chronic, unremitting depression for nearly 40 years. And her mom did everything that the doctors told her, went to therapy, took copious amounts of drugs, had 37 ECT procedures, and was hospitalized. I kept wondering, why could I recover and she couldn't? And the answers to that question were in a folder in my sister's attic, which contained 30 years of my dad's records.
That's a really compelling narrative sharing, and I might only be able to do a summary. And I think for future reference, it will be helpful if you break your paragraphs shorter, so that I try to.
Okay. Sorry, that was one paragraph. So.
Oh, okay. Also, I will start with translation. And if any person notice any important information I missed, please put into the Q&A. I will read that aloud. 我的名字是 Ann Bracken. 我是一位诗人作家。我最近出了一本书，它的名字是关于一本过度使用药物以及自我疗愈的自传。就是我出这本书主要是因为就是自己跟那个刚才我们看到的纪录片里面的一些人经历非常类似。我在90年代的时候有那个4年的抑郁，还有7年的那个头疼，然后那时候医生给我开了很多精神类的药物，这些药物不仅没有起到疗愈的作用，反而给我造成了很大的伤害。除此之外，我这本自传里还讲到了我的母亲。我在我父亲的那个阁楼里面曾经找到了他的就医记录，他30多年的那个过度用药的就医记录。然后我自己试图解答的一个问题是，为什么我的母亲在这么多年做了治疗之后并没有疗愈，而我疗愈了。我自己的那个反思是，我的疗愈归功于我的那个精神宗教方面的信仰，我的咨询师，还有其他方面，不好意思，我忘了。我看那个 Q&A 有没有信息的补充。还有诗歌治疗，谢谢。好，Ann, do you have anything to add?
I got well, thankfully, from reading a couple of books. Prozac Backlash by Joseph Glenmullen and Anatomy of an Epidemic by Robert Whitaker. I got off of all the psychiatric drugs and the opioids, and I've been off of all medication for over 20 years. So I'm very grateful for those authors that I mentioned. And that's why I'm here, because I would hate to see this happen to anyone else. And from talking to friends and reading a lot of articles, I know that my story is not unusual.
And can you put the name of the books into the chat box?
Yes.
That the participants can see.
Sure.
我有20多年的时间已经不用药了。在过去的 10多年、几十年里面我曾经读过的一些书对我的帮助很大，帮助我促进这样一段疗愈的过程。然后关于我这个过度用药的经历至少在美国来说是不少见的，这也是促进我要分享我这些经验，然后成为这方面的倡导者的原因之一。Thank you, Ann. Ann 把那个书名放到了聊天框里面。So I'm gonna show the cover of your book, and before we switch to David, do you have anything to add?
No, thank you for inviting me. And I just appreciate being here and being able to talk about this topic with a lot of interested people.
Can you see the cover?
Yes.
Okay. 这个就是安他的出的书的封面。他的书刚出版没多久，现在还没有中文版。Is it correct that your book does not have a Chinese version yet?
I don't know. I would have to go into my publisher's website and I can let you know.
Okay. And one quick question before we switch to David. How to get contact with you? Can you put it in the chat box?
Yes.
就是我让安把他的联系方式放到那个聊天框里面，然后因为时间关系，我们转到 David， 然后呢就是那个会梳理一下已经在 Q&A 里面出现的问题。David, now it's your turn to do the self-introduction, and just so great to see you in the film and be here live, except bad on my end that I did not play well enough and people cannot see you. Sorry about that.
It's all right. I hope my voice will make some difference. Thank you for having me on. And my name is David Cohen, and my profession is a clinical social worker. I've practiced in a couple of countries and in a few states in the United States. And I'm also a researcher and currently a professor at UCLA in Los Angeles, and a professor of social welfare. And I have, for about 35, 40 years already now, been studying this topic of the effects of psychiatric drugs, and especially how to come off psychiatric drugs, the withdrawal effects that coming off causes. And I have worked with many people who were in the situation that Ann Bracken described, having undergone a number of treatments and interventions for psychological distress and other problems, and experiencing negative outcomes or having troubles with the drugs themselves, but having difficulty withdrawing.
大家好。
Maybe translate that, yeah.
Sure. 大家好，我叫 David Cohen，我的临床身份是临床社工，我在不同的国家以及在美国不同的州有过从业，然后我的学术身份是我是 UCLA 的教授，然后我近40年来的时间，我研究的主要的内容是精神类药物对人的健康造成的影响，以及戒断之后可能出现的反应，然后我在临床方面也帮助过很多像安这样的那个过度用药，然后需要 减轻药量或者停药，然后同时遇到相关的一些困难和问题的人。Go ahead, David.
So I have the luxury of having seen how discussion about problems caused by psychiatric drugs, how that discussion has evolved, say, over the last 30, 40 years. 30 years ago, it was difficult to openly discuss that topic, even in scientific journals. It was a fairly rare occurrence that people would describe psychiatric drug withdrawal. The problems with antidepressants were just beginning. Those with benzodiazepines were well known, but still it was always believed that only illicit drugs or opiates and maybe benzodiazepines and barbiturates, sort of Asian drugs, would cause these problems, but not modern prescription drugs. That has changed dramatically, but it's still not a perfect situation, and most people are not informed.
我研究的过程中观察到的现象是在很多年以来一直被公认的会造成依赖有那个戒断困难的主要包括是那个违禁药以及鸦片类药还有苯二氮唑类药这样的药物但是更加新兴的那些药物，比方说抗抑郁药这些药关于他们是不是那个会造成依赖，造成严重的戒断反应这个在之前几十年通常是那个没有被公开讨论，也没有那个被放到聚光灯底下去研究的。但是最近一段时间以来，就是新兴药物它们造成的依赖还有其他的问题在得到越来越多的关注。
And the final point maybe that I could make is so I've written extensively already starting in the 1990s on this topic. And I think I sent you a copy of, I believe, the Chinese translation of the book that Peter Bracken, who's a psychiatrist, and myself wrote already in 1999, and then revised in 2007, and called Your Drug May Be Your Problem. And that, I dare say, was one of the sort of first discussions that expanded this issue that we have seen in the movie Medicating Normal to suggest that many drugs cause problems around withdrawal and might make their users a little worse. Not everybody, but a sizable number. And so what we know now, I think what is different today is that there are many more resources available for people to come off drugs. And there are also many more discussions that have updated the numbers of people affected by problems with their medications. So we have much more information, but it is still a difficult system. It's a cultural almost instinct, if I would say, that people regularly think when they are not feeling good because of their circumstances, they still go to the doctor and the doctor still says, here's a drug. And that is, this is the truth. This is how it works. We all do that. And so it's important generally, if we are speaking to mental health professionals, not to encourage immediately people to go on drugs. The best way to avoid all these problems is not to start on a medication. And that you have to really feel that you need it objectively, not that it's simply being recommended because everybody else does it. And I'll stop here now. Thank you.
A quick question, David. Which year did you and Peter Bracken publish the book?
So the revised edition is 2007, and I believe that the cover that you're seeing here, if I recall well, it was published in 2010 or 2009. This one here, the Chinese edition, and I have not seen the Chinese edition, but I know it was published. It was not an authorized edition, but the book did appear, and I received comments from some readers of it. And so it seems to be out there, but that must be about almost 15 years ago, or 13 or so years ago that it has come out already in Chinese.
Got it. Thank you. So, 我在早些年和精神科医生Peter Bracken 一起合写了一本书 Your Drug May Be Your Problem， 它的中文翻译是它有一个台湾出的中文译本大概是几年之后出的，是叫为药疯狂那个时候这样的资源还很少但是那个最近几年类似的资料读物讨论越来越丰厚了然而尽管如此在那个在人们在那个有这个心理健康问题的时候寻求专业帮助尤其是医疗帮助的时候医生仍然会建议他们在第一时间建议他们要考虑精神类药物然后我希望那个作为专业人士能够建议来访或者病人考虑的是可不可以有其他的可以帮助自己疗愈的方法。Okay. David, do you have anything to add?
I'll be happy to answer questions or anything, although I believe my chat is disabled. I do not think I can enter anything in the chat, it tells me, but I may be in the Q&A box, question and answer. I could put information there.
Okay, good.
So
let's learn.
It's all good.
Okay, so we don't have much time left and I will just read from the newest to the oldest questions or comments from the Q&A. One said, thank you for your dedicated work, David. I'm wondering what actions the US government or the medical system is taking to avoid the problems. It sounds like there's only public awareness project like this documentary. Let me translate that into Chinese first. 就是有一个问题是给 David 的，他说那个他好奇美国政府或者美国医疗系统有没有采取措施来应对或者避免这个问题看起来好像更多的是就是从草根性的这种公众的知觉的这种项目，比方说这个纪录片。Go ahead.
To give as brief an answer as I can to this, we can look at the government agency in America called the Food and Drug Administration, FDA, which approves putting on the market psychiatric drugs and any other medications in America. And this agency is very, very informed and knows very well the withdrawal effects of drugs. It knows them. It has extensive data from all the studies it receives. And it knows what it could do in order to really make those effects visible during their studies and to discuss them. And there has been some progress so that now manufacturers put on the labels that are in the medication boxes. There usually is, for example, for almost every antidepressant, a brief mention that if you are stopping it, it must be gradual, and which did not appear even 10 years ago. But this is a change already. It is a big change. It just lets people know that you could expect some problems, but the FDA downplays, it minimizes what these dangers could be, but there is some change. Just to tell you, there's a little bit of progress at the institutional governmental level, but there could be much more.
简要的回答这个问题的话，就是美国的食品和药品监测局 FDA 他们掌握了非常详细的关于药物的那个戒断症状以及它一些问题的具体的信息，但是那个从机构的角度，这个变化非常缓慢但同时还是有一些不错的进展，比方说现在那个一些精神类药品的那个说明上会出现那个如果是要停药的话一定要缓慢进行，这个在10多年之前都是没有的，这也是算是一个进步。And 我再往下看 I'm gonna scroll up to the older questions and comments in the Q&A. This chat saying that they could not see your response, and were you able to send it to everyone? Oh,
yes, I sent it to everyone, but if you want to put it in the Q&A, I can do that.
You send it to host and panelist, actually, not
those were my only two choices.
Oh, okay. I'm gonna do that right after we end, so that we do not take up more of the time. And sorry everyone, there's so many disablings here. I'm very sorry about that. We definitely have successfully avoided the Zoom bummers, but also so inconvenient for everyone. 非常抱歉，这次这个webinar 设置有太多不方便大家的地方非常抱歉。我待会儿那个结束的时候，我会把安放在 chat 里的东西粘贴了发给大家，非常抱歉。
Should I put the information in the Q&A?
You can try if you can. Yeah. Okay. Oh, if you put it in Q&A, actually no. Only I see it.
Okay.
So there's another question. Is there no measure to deal with the medication research fraud, possibly as part of a cleanup? So 这个问题是那个有没有一些具体的措施来处理在那个医学研究里的这些这些重要的腐败问题，作为一个就是清扫或者是那个净化研究的这样的一个过程。David, I think that's a question for you as well.
So let me try to answer this if I understand what the questioner is asking. Let's just put it this way. The enterprise, I mean the whole activity of taking medications for problems with our soul, our spirit, our mind, whatever we want to call it, is a big one. So let's say in the United States, we've got probably about 20% of people, easily 1 in 5, who are taking some kind of mind and mood altering medication. At least that's just so that you can it's a huge industry. It's equivalent to the transportation industry or the automobile industry or the cosmetics industry or the education industry. So it's not simple to say there is fraud going on. What is the government doing? It means that it is a whole way that modern societies function today. And so in that environment, it's not sufficient to say there is fraud from industry and corporations. It's really the first level of protection, unfortunately, has to be self-protection. And so people have to inform themselves as best as they can and try to find trusted people they can discuss this with. And that's one level. But there is no simple way to change this huge activity of people taking medications because they suffer from all kinds of problems that we don't understand well or that are very social in nature. And so that's just one level of answer that I could give at this time. It's not a complete answer at all.
抱歉，我刚才在看聊天，没有仔细听 David 的那个回答，然后我能抓住的一些部分是那个他说那个就是那个在系统上要处理这个问题非常复杂，非常的难，然后重要的以及就是非常不幸的一点是如果要那个比较谨慎的处理用药的问题的话，第一步是那个对我们自己个人来说要好好做到就是自己去就是寻找类似的信息，然后做自我教育和那个学习那样子如果有什么补充的话，请在Q&A 加一下，不好意思。And another question is I think I'll just say it quickly about like whether or not over medication is pretty big problems in the VA system. A quick answer is yes. 就是在退伍军人健保系统是不是这方面很多？对的，是的。So go to the next question. So one person says that like the mood of depression is different from depressive disorder. Normal people cannot differentiate these, and please give some guidance. 中文是抑郁和抑郁症是不同的，一般人不会区分，请给予指导。I think this is a question for either or both of you about differentiating depression as a mood and depression as a disorder. Go ahead.
I don't have the clinical background to speak about that, but what I am observing with my friends and in the literature is that we in the United States and a lot of Europe are presented with the idea that the problem is an individual problem and it's within us. The chemical imbalance theory still is not dead. Many people still talk about that and believe in it. And I think part of it is part of what I hope to do with telling my story is to help change the paradigm that it wasn't a problem within me. If it were, then I would have gotten well with all the drugs they were giving me. The problem was in my life circumstances. And until I could address the things that were really bothering me in my life circumstances, I wasn't able to get well. And no one offered that idea to me. I had that idea myself, despite what all the doctors told me.
Thank you for sharing that. And 就是从我个人以及我身边我观察的身边的人的情况来说，就是每个人的问题情形都不太一样。然后现在这个社会来说，那个化学失衡这样的叙事特别流行。我希望的是做一个那个对那个人的这种抑郁以及其他的精神状况一个更加彻底的理解上的转变。那就是要理解 具体的不同的人的这个情境，而不是把这个人当作问题来看。然后我这么多年来，我的医生从来没有告诉我这一点，是我自己琢磨领会出来的这样重要的一点就是要帮助改变我以及其他人的情境，而不是只是关注或者是病理化某一个人。David, do you have anything to add?
I have so much to add, but what Anne has expressed just now is very on target. And all I could add is something like, there is no neutral way to approach something that we call depression. You have to have a kind of view already of what that could be. My own view is it is a universal reaction to loss. What kind of loss? Any loss. Loss of your wallet, loss of your spouse, loss of power, loss of status, loss of something you hope to achieve, loss of many kinds of losses. So it's not the nature of the quote unquote disorder that matters. It's just that maybe the nature of the loss. It's the nature of your circumstances during that loss. It's your life facing those circumstances. So it's not so much, when do I know that I should distinguish normal loss or reaction to loss from a disorder? That to me is an irrelevant question. It's like saying, is it different to be thirsty or to be very thirsty? No, it's still thirst. It's still all about thirst. Very or a lot is the same as, it's the same kind of mechanism, if you want to put it that way. So I just call upon people to have more trust that they understand what may be going on and that they discuss it with others and be open to alternative views.
我非常赞同安刚才的观点，然后我想补充的一点是，我对抑郁的理解是，它是非常泛化的一种丧失的一种体验。丧失它就可以有很多方面了，比方说关系上的丧失，工作上的，还有其他方面的情境上的一些丧失。然后对我来说，就是抑郁到底是不是病，是一个暂时的状态，还是一个病的状态？不是那么重要这好像就是问我就是这个人到底有多渴，是有点渴，很渴，还是非常非常渴？对我来说不是特别重要的问题我觉得想要强调的一点是当一个人有抑郁这种体验的时候去得到支持，同时了解一些不同的就是让自己打开眼界，了解一些不同的视角，去了解自己的这个痛苦和苦难。We have crossed the time boundary and we still have questions, and I understand if either or both of you have to go, you can leave now. If either of you might have time to stick around for another 15 minutes, that would be great too. Let me know.
I can do that.
I can do that too.
That's great. I really appreciate that, both of you. I just really feel your wisdom and passion, even though I don't get to see your faces. Your voice is so powerful still. So another question that's also an older question in the Q&A. I will read in Chinese first and then translate. 想请问一下，如果不服药，片中的这几位受访者将通过怎样的方式恢复呢？是心理治疗吗？以及如何区分需要吃药的人和不需要吃药的人呢？ I would like to know if not having medications, the people in the film, like how could they recover? How could they heal from their pains is psychotherapy, and also how to differentiate people who need the psychiatric meds and people who don't? I think that's a question for both of you.
I really wish that somebody had said to me, Ann, let's take a look at the way that you grew up. Let's take a look at what all the things that happened with your mother when you were a child. Let's take a look at how painful your marriage is. Of course, you're going to feel sad and overwhelmed in these circumstances. And let's work together to develop some tools to help you get back to yourself, feel better again. But instead, I feel like the medicines damaged me, just like the people in the film. I was so numb by the drugs that I also wanted to kill myself. And so I thought the only way out was to have electroconvulsive therapy. I just can't tell you how damaging the system is. And, part of the reason I tell my mother's story is to say, look, this has been going on for over 60 years. This is not new. It happened to me in the 90s. It happened to my mother in the 60s, and it's happening to people now. So I think you get well by doing your internal work and by developing some tools to deal with your life circumstances. And that's so much harder to do than to take a prescription, because that involves basically changing the ecosystem that you live in. And that's always hard work.
我非常希望，在多年前有人会告诉我说，那个安，我们坐下来好好深入的理解一下你所经历的这些情形，你的小时候的成长环境，你的婚姻里的这些问题和困难，还有其他的一些重要的情境，我希望有人能够帮助我去理解我的这些苦难，然后我会学习去用一些其他的工具去处理，甚至去努力去改变我的情境，而不是选择用药。当然那个要改变自己的情境要难很多，跟用药比起来，但是这么多年的用药，对我的身体是很大的破坏。比方说我当时还用了那个电击休克疗法，它对我的记忆也有很大的伤害。David, do you have anything to
Yes, let me suggest I will answer this in two parts. So I will say a first part briefly, and then I will say a second part. Is that okay?
Sure.
So the first part is, there is no objective way to decide that someone needs a medication. It is not an objective decision. It is like, think about this. When do you know that you need to go to school? When do you know that you need to get a tattoo? When do you know that you need to start an exercise program? When do you know that you need to undergo cosmetic surgery? So these interventions, in my view, are equivalent to taking a drug. There is no objective way to say, I objectively need to change my body with some surgery or change my appearance. It's something you want, you know something about, you've heard others who've done it, and you feel it will be something. So that's how one makes those decisions. It is not a simple answer. When do you know that it's needed? So that's the first part.
我想把我的回答分成2部分啊。第一部分是这样的，就是我不觉得有一个客观的方式可以分，比方说，你在什么时候可以开始吃药，或者是什么样的人在什么时候可以开始吃药，这就好像是问，一个人小时候从几岁开始可以上学，他从什么时候可以开始锻炼身体，他什么时候可以开始那个，往身上刺青呢？或者什么时候可以开始做一个那个美容手术呢？就是其实是很类似的问题，就是它并没有一个真正的一个客观的指标。这一般来说好像是就是你听别人说这个人他干了些什么，他用了什么药，他怎么样，然后就有时候是有一种这种跟风的，或者跟着这个世俗习惯的这样的一个现象，它没有一个客观性。Next, David.
The second part of the answer is that once a decision is made to start medication, there is almost never a predictable path. The outcome is extremely variable, extremely dynamic. People can immediately decide, I stop. I'm done with this after a few days. People can decide not to even get the prescription at the pharmacy and even get the drug. People can decide to do it, then a second drug may be added, the dosage may be increased, it may be lowered, adverse effects can appear. All of these options are possible and occur. And it's hard to predict in an individual case what actually happens. So the decision may be very simple, but the process and the outcomes are extremely complex, sometimes can be life-threatening. So this is the fact. So it's not so much, should I start it or not? It doesn't mean anything. You might start it and never be able to stop it, or you might start it and it will do nothing to you, or you might start it and it might be beneficial for a while. All of this is possible. I'm just trying to say that it's more not the decision, it's what happens when you start on it that you should be thinking about and learning more about.
对于用药这个事情，它不是只是那个做不做这个决定那么简单，就是你那个做了这个决定之后有更多未知的事情、不可预测的事情。比方说那个你可能那个被开了这个药方之后，你也不去取药，或者说是你去取了药之后吃了一下，发现那个很难受就不吃了，或者是那个你去取了之后发现它有短期的益处，或者是吃了之后那个经常会不同的药调高调低这个剂量，或者说要加另外一个药或者是那个可能会用药用很长的一段时间。就对我来说那个这个问题不是那个决定这一步那么简单，更复杂的是在这之后的一些就是每个人个体的可能不同的出现的反应，不同的这个过程，它有很大的复杂性。Okay, next question. Well, I 5 more minutes left, and I really want to respect everyone's boundary this time. So let me maybe find a representative question here as the wrapping up question. I think that is a really good one. Which is and also both it's written both in Chinese and English. 作为心理咨询师，该如何给来访用药方面的建议？尤其是得知来访在医生的建议下服用苯二氮卓类药物超过6周时间。影片说会有严重的副作用，但医生却没有知情同意时，这位问问题的是，我想说这个问题我也经常遇到，谢谢你问这个问题。So the English version is that as a psychological counselor, after watching this documentary, I'm not sure how to give advice to clients regarding medication, because there's one situation when, like, if I know the client is already been on a benzo for over 6 weeks, but like learning from the research on Xanax on the documentary, I know that like they can be a diverse side effect, and the effect can diminish after 4 weeks. But when the doctor hasn't obtained the informed consent, what can I do as the psychological counselor in this case? Yeah, I would want to open this question to both of you as well.
But if Ann wants to go ahead, please.
Thank you, David. This is something I struggle with more on a personal level, that I have a lot of friends that take psychiatric drugs. And I'll just say, as a rule, most of their doctors do not sit down and talk with them about the possible adverse effects of the drugs that they're prescribing. And I know several people taking benzodiazepine drugs, and they have been taking them for years, just like I did. So, you know, it's not a common practice that patients are giving informed consent. Most people don't even know that you should have this discussion with your doctor, and that your doctor should be telling you the prescription guidelines and how long you can take it, and at what point you know, you might start experiencing negative effects from it, and what you can do as an alternative. That's really part of the education that Mad in America does, and that I have a minor opportunity to do when I talk with people.
这个问题非常普遍，我身边也有一些朋友以及我自己，就是在那个医生没有给我们足够的获取知情同意的前提下，那个用了很多年的 benzo 而不知道它的一些不好的情况。And I want to have a quick follow-up question because I just listened to your interview with Jason, right? You spelled out the 4 elements of informed consent. Can you say that here? And let me say that quickly in Chinese too. 我想请安来那个说明一下那个知情同意的4个要点。
The 4 elements, as I understand them, are for the doctor to talk with the patient about the possible benefits of taking the drug, the possible negative effects of taking the drug, any alternatives that the patient might also try, and also what it will look like to withdraw from the drug. So those 4 elements, as I understand it, are what constitutes informed consent.
Thank you. 这个关于知情同意的4个要点是：第一，这个药它可能的益处是什么；第二，这个药它可能的害处是什么；第三，就是有没有其他的那个可以用来治疗的非药物的方式。第4是那个如果我停药的时候，我可能会出现什么样的反应。Thank you, Anne. David, your turn.
Thank you. So this is a complex question because it involves relations between different professions. One of the professions has the authority to prescribe the drug, that is to allow the patient to get that drug. And the other profession is a bystander in some way, is watching the whole thing, usually approving it, but not necessarily warning about it. So that is a hazy, complex area of interaction with both the other profession and with the patient or client. So that's the first thing to say. No simple answers here. The second part, I guess, of the answer is that you have to be responsible for your own services. What you offer the client, you have to be responsible for that. And that means if education is part of your services, then you owe the client. If you work for their interest, you owe them the information that you know that you understand, that you consider credible, and you consider that you would like to know that information, then you owe it to them. You owe it to divulge that information to them. That's the first thing. And the second is you owe to tell the physician that you have this information and you are sharing it with their patient also. And you should also tell the person themselves, the client, what is it that you really want to know? What are your concerns? And to help them, to write them down and to ask the physician. So the work for the mental health professional is complex. It's multi-pronged. There's at least 3 things they should be doing: providing the information they have that they have filtered themselves, and telling the physician telling the physician that they have this information and are sharing it with the patient, and then helping the patient to better question the physician. That's a start.
So 这是一个比较复杂的情形，因为那个就是开药的那个权威不是你，是另外一位同行同行专业就是可以有出具开药权的专业人士，然后你作为旁观者就是会处在一个比较复杂的位置，但同时我想强调的是，就是你作为来访或者病人的咨询师，你自己的职责所在是什么？就是如果你觉得你掌握了比较可信的信息，如果你的职责所在是帮助提供信息给这个来访，那就是就好像如果你是处在这个来访的位置上，你想得到怎样的信息和支持，那你就应该给来访提供这样的信息和支持。总的来说，就是你可以做的有3点。第一个是那个给来访或者病人提供相关的信息。第二就是给那个开药的这位医生来提供提供这样的信息。第三点是那个帮助你的来访或者病人跟那个他开药的医生进行沟通，这样子。Okay, I wish we had more time, but I just really appreciate both of you for your dedication to this course and the time, the effort, the wisdom that you have generously contributed here. And David, I'm going to stick around a bit to kind of pass on some information that Ann you shared with the other participants who want to know about. A quick question, David. What is the best way if someone from the audience would like to get in touch with you?
It's to send me an email, which I can put in the question right now and then maybe you could copy that and put in the chat. I've just sent it right now.
Okay, I will do that. Okay, 我会把科恩博士的那个邮件信箱也发在 chat 里面，发给大家。那个在结束这个之后的几分钟里面，非常感谢大家的参与。那个因为那个有翻译的这个在里面，所以整个过程会慢一些。然后也感谢大家的耐心。Okay, I want to end this film screening and the discussion with a quote from someone who had a lot of influence on me, Thomas Sass. I heard this from one of his interviews. He said, we are all in this together because we are all in life. Thanks a lot for the 2 of you for being here and for the audience for being here. 我想引用对我影响很大的 美国的精神科医生汤姆萨斯曾经说过的一句话，他说我们都在一起，因为我们都在生活里。感谢两位嘉宾的参与，以及感谢所有来观影和参加讨论的室友们的参与，谢谢大家。这次的观影和讨论就此结束。Okay. Thank you so much. Now it's finished.
Thank you. Thank you, Ann, too.
Thank you. Thank you, David.
Thank you.
I appreciate all your work. I've been following you on all kinds of podcasts